Throughout Black History Month, WFOY News 2 is highlighting the work of Black leaders and their impact here in the Triad. Francis Almonor is a respiratory therapist with Atrium Health Wake Forest Baptist. I spoke with him about the importance of Black History Month and the inspiration he has received working on the front line of the COVID-19 pandemic. Francis Almonor is many things: a Haitian American, husband, father, and a former U.S. serviceman.
If they need more oxygen.
He now works on the front line of the COVID-19 pandemic as a respiratory therapist with Atrium Health Wake Forest Baptist.
We are literally at the front line because we are literally helping with intubation, put the patient on a ventilator, literally helping them breathe.
Almonor says the past 2 years have been tough, both personally and professionally. He lost both his parents to COVID-19 early in the pandemic, before the rollout of vaccines.
The general public, they don't see what the healthcare providers see on a daily basis. My feeling is, if they have seen what we see on a daily basis, they would try to protect themselves, they would try to get the vaccine.
Almonor has worked at Atrium Health Wake Forest Baptist for almost 20 years and currently manages 53 respiratory therapists at the hospital. Along with his faith, he credits the leadership of Black figures like Dr. Martin Luther King Jr., Nelson Mandela, and Toussaint Louverture for creating opportunities for him to do the work that he does today.
Starting as a respiratory therapist, become a supervisor, and then getting a leadership position. So it's all the work that the previous leader, they have done to pave the way for myself.
This year's theme for Black History Month is health and wellness, a topic Almonor says he promotes in his work daily.
Community of color are affected differently with different health issues. So it's very important that we emphasize and recognize the issue that affect minority.
As the pandemic rages on, his message to everyone, no matter their background.
If you have an opportunity to get the vaccine, get it. It will be beneficial to you and to your family.
Almonor shared what Black History Month means to him, and I asked you on Facebook, what does Black History Month mean to you? We'll look at what you had to say in the next half hour.
So he had 50, he's over a staff of 53 people, is that what he said?
Yes, respiratory therapists.
It's interesting to me to hear, because a respiratory therapist, that's been most of what COVID was, especially in the beginning, right? And what he's seen probably motivates him not only as a healthcare professional, but just as a human being to say, you got to get vaccinated.
Absolutely. He says they're more likely to get exposed to this virus because they're there putting the patient on the ventilator. So it's really been a chaotic time for him.
And hard personally too, I'm sure, with his parents and everything. How is he handling all of that?
Well, you know, he lost both of his parents very early on in the pandemic, and it's been tough, as it would for anyone or many people who did lose a loved one, but that's why he's so passionate about this and talking about the importance of getting vaccinated. I also liked, in light of Black History Month, that correlation between the two in health, because the theme is health and wellness, and it just brings up many topics about access to health care, good access to health care for people of color, and that people of color are more likely to get certain diseases like heart disease or even diabetes and things of that nature, and just bringing that topic to the forefront.
And you know, he has to feel a sense of responsibility as a person of color to make sure that that's taken care of. You know?
And to inspire other people to think about being a respiratory therapist. He says there is a great need for them. There's not a lot of them out there right now, and especially as this pandemic rages on, they're very much needed.
I think one thing that stood out to me, what he said, was talking about how if people saw what we see every day, then they would want to protect themselves.
He talked about that. He talked about misinformation and seeing people downplay it on social media and different things like, oh, it's just a cold. But he was like, if you saw what I had to see every day, literally trying to help people breathe, you would definitely think differently.
Oh, such a helpless feeling too when you're with someone that's going through a struggle like that and there's nothing you can do, you know, just, I know he's seen a lot. All right, good, nice story.
Great story.
Yeah, really nice job. We're coming right back.